And like we have mentioned before, that this series of webinars is recorded. However, the section where you share your questions and it is personal is not used on any social media platform. We do record this because we get a large number of people who may want to watch these videos later. We haven't published them yet, but we will be publishing them in the near future. Nabia, can you help move to the next slide, please? I would like to welcome each one of you to our 11th webinar, and we are delighted to be presenting to you in our series. Nabia, there's something wrong. Okay, may I suggest, Nabia, that you stop the share?
Okay.
Yeah. And here's what I will do. Can we see the screen now?
Yeah. Yeah.
Okay, thank you. So, a very, very warm welcome to each one of you, and very grateful for the fact that you have taken the time off on this Friday afternoon to spend some time with us. At Caregiver Saathi, we run a series of webinars called Compassionate Caring. The idea of these webinars is to introduce caregivers and caring in a new light, for us to understand what might it mean for us to offer caregiving, offer caring, but at the same time have a compassionate tenor to it. So I would like to take a little while to talk to you about Caregiver Saathi before I introduce our very, very dear and very eminent speaker today. Uh, Caregiver Saathi is an endeavor to create an ecosystem of well-being and healing for the primary caregivers. Primary caregivers tend to be that one person who looks after a loved one emotionally, physically, financially, or in any other form. And family caregivers of those who are navigating terminal illness or any other chronic or life limiting conditions have very unique challenges, and we support them through their caregiving journeys and hopefully beyond. We wish to create an environment of well being so that the caregivers feel empowered themselves, and that the caregiver and the care receiver can have a sense of leading a full life, irrespective of how long the life is. How do we do this? We do this through technology enabled systems for creating human connection. We have awareness programs that are both online and offline. We have a helpline. We conduct healing circles or support groups for caregivers, irrespective of the medical condition. And during and beyond the caregiving journey, we have communication through our social media platforms, and we provide access to relevant information in the size and the form that a caregiver may need at that point in time. Caregiving journeys can be fairly overwhelming, and today information is available. However, it may need to be managed in the small quantity that is palatable. Uh, we would like to leverage technology-enabled support systems, both in terms of a platform as well as an app. So what we have done so far is that we have built a platform, an app, and a website. We conduct training programs and various education platforms, both online and offline. Caregiver Saathi app is a tool for caregivers to be able to organize themselves, One of the biggest concerns that caregivers have is that they are unable to create the time for self care. And we believe that a tool like the Caregiver Saathi app can make that easier for them. So, those of you who don't have the app, I would recommend that you download the app, use it, and give us feedback so that we can keep improving on it. We have a community both on Facebook as well as in WhatsApp as well as offline, so that people can interact with each other. Caregivers can share their information, their experience, their tips, and be able to provide each other support. We run a video series which is Caregiver Stories called Gentle Warriors. And if you know of caregivers who would be happy or who would be keen and motivated to share their stories, then we would love to showcase them and introduce their journeys through the Gentle Warrior series. It's important to note that sharing your story can be healing, not just for the caregiver, but also inspiring for those who listen to these caregiving stories. We have one such person here who has shared his story in the caregiving, in the Gentle Warrior series. So Pranada is here, and Compassionate Caring is our series where we showcase experts and experts who give us a perspective on caregivers and caregiving in a manner that both the caregiver as well as the care receiver can have healthy, full, complete for everybody involved. We have a program called Caregiver Coaching. Caregiver Coaching is a series of interventions, which is a one-on-one program for caregivers should they need the support so that they can be taken through their caregiving journey and their caregiving journey can be made easy. A family counseling program as well as a volunteer-based respite care program. This program is on hold currently. However, we are looking for volunteers who can help us build content as well as outreach. So if you are interested in investing your time and enabling and supporting caregivers, then we would strongly recommend that you sign up for our volunteer program. I have covered part of this in the previous slide in my excitement, but you could join the healing circles, you could share your caregiving story, you could spread the word, and you could volunteer with us. We are an entirely contribution-led organization, so raising funds and donating is a big part. We do have an internship program. I can see that we have some interns who have joined in today. So I would like to believe that our internship program can be fairly enriching for those who go through that. And if you believe that there are some people who could go through the internship program, recommend them to us. Finally, referrals and partnership with hospitals and organizations is something that we would like to do to spread the word and to shine the light on caregivers and caregiving. Our framework that we use for looking at well-being of an individual, especially a caregiver, has 7 elements: physiological, financial, legal, psychological, spiritual, social, life and work purpose, and creative expression. We believe that stress can be caused by an imbalance in the various aspects or elements of well-being, and unaddressed chronic stress can lead to mental health issues. So, building resilience through practices of mind, body, and soul are probably the best way to encounter or prevent burnout. So, I was using an old slides and from our previous speaker. So, if you will give me a second, I would like to bring up the slide to introduce our speaker for today. It is going to be very hard to introduce the speaker for today through one slide, but our speaker for today is a very, very dear friend and mentor, Dr. Rajagopal, who is also the chairman of Pallium India. I had the pleasure to meet him during a screening of a film called Hippocratic. And well, I had known of his work up until then. And I have to say that he is one of those people that have not only influenced me personally, but has influenced a very large number of people over the last 30 years that he has been working in the area of palliative care and helping develop not just people, but institutions and organizations. Dr. Raj, you'll have probably not do justice to an introduction to all the work that you have done, but suffice to say that you have been the flag bearer of palliative care and holistic care for patients that have struggled with our current healthcare system that may ignore those that have incurable conditions. So, introducing palliative care to our country, bringing various aspects of that in terms of its advocacy and helping build organizations like Caregiver Saathi is something that I hold you in very, very high regard for. Uh, it will never be enough to speak about your accomplishments and contributions, but I'd like to say that I am very grateful and blessed to have you for a mentor for Caregiver Saathi and the guidance that you have given us. Uh, Thank you so much. And with that, I would like to give some basic admin announcements to the participants. May I request you all to be on mute so that we can listen to the speaker today without any disruption. We are talking about an unexplored and fairly sensitive topic today. The topic for today is children who are caregivers, um, and what does it mean when children are caregivers. My first interaction with Dr. Raj, who is extremely, I'm looking for the right word, who is extremely not just experienced, but adept at picking up subtle nuances, pointed out to me that there is significant trauma that children go through when there is illness in family. He said something that haunts me and impacts me to the day. He said that think about that child who grows up in a home of illness. What about that child who didn't get enough hugs and enough kisses because the parents were busy addressing the illness? How are we going to address the needs of those children who grow up without adequate love? And that comment has haunted me. And I would like to invite Dr. Raj today for a conversation uh, on the same topic so that we can have greater awareness and sensitivity to children who are caregivers.
Thank you, Bhavana, for that generous introduction. And I see many friends around here and several people whom I have not met personally. Warm welcome to you. I was generously given half an hour by Bhavana, and I decided that I would also have 3 invited speakers to fill that 30 minutes. And I shall be mostly telling you stories. Let me start with one. Some of those stories are rather hard to hear, will be painful, but I'm sure there is a positive aspect to those very sad stories too. They taught me a lot, and maybe they will be educative for all of us. Our organization, Palim India, and its Trivandrum Institute, runs a children's palliative care clinic every Thursday in the very crowded and busy Government Medical College Hospital in Trivandrum. Many years back, on the first day of the clinic, as we were walking towards, our team was walking towards the clinic, we could hear a child's screams. The screams came from an 1.5-year-old child. The child had an infection in the brain, encephalitis. When that was treated, it left the child with such damaged brain that all the time the child was going into muscle spasms. You can imagine how painful a cramp is when you get one. Here, all the time, the child is getting cramps and the child was screaming. And the worst part is, the child had been screaming like that for 3 weeks. The father had lost the job. He had no income. The mother stood with no expression at all in a corner of the room, like a zombie. We later learned that once the child's suffering, the intense suffering started, she had lost her mind. And a girl who looked to be around 10 years old, the baby's elder sister, had taken over the job of being mother. She was standing there caring for the baby and telling us what the problems were. It was painful to watch. Later on, the father quietly told us that he had actually decided to give poison to the 3 of them, make sure that they are dead, and then commit suicide himself. That was his plan. Well, I will come back to that child's story later, but the father lost his job, the mother lost her mind, and what the child lost was the child's childhood. What happens when a child is laden with responsibilities that are too huge for that age? I have the privilege to work with my executive assistant, come children's counselor, come counselor for children with disabilities, and activist, Ashla Rani. I have the privilege of sharing my office with her. The Kerala government declared her the youth icon in 2016. Ashla, in one of our conversations, you said, Ashla, by the way, a few years back, she's a software professional. Few years back, she had an accident, had a cervical spine injury, and is a tetraplegic. She cannot type with her fingers, so she types with her knuckles like this, and she uses a wheelchair. Ashla, you told me what happened when you lost your dad long before your accident. I have forgotten at what age, maybe 8 or something. What role was thrust on you and how it affected you? Ashla, would you like to share that story with us?
Sure, sir. Thank you. So, I lost my dad when I was almost 8, and it was a sudden and unexpected death. He went for his consultation for hypertension one morning, and then he had a heart attack while returning, and he came home dead. So he was 43, and my mother was 36, and my sister was 16 or 15. So like he was so young, and then so he used to have all my distant relatives and everybody visiting very often because it was so tragic, and then they were all so sympathetic with my mother. I don't remember many of those conversations, but I still remember some of those. Like they used to tell her that, what are you going to do? So young, you have two daughters. Like having two girls were like sin at that time. I come from a very rural village, so even now I'm not sure whether daughters are how daughters are considered when you have two in the family. So it was at that time, and then they never always ask, "What are you going to do?" It must be very difficult for you. It will be very difficult for you. We don't know what are you going to do. And during one of, and she was so like in a shock. She never used to eat properly, and then she used to faint often. And like a doctor used to visit us regularly to give her some treatment. So it was that kind of a situation. And then I remember during one of those like visits, one of those people told me that, like, yeah, now like you lost your dad, and now you have your mother and sister, and it's your responsibility to take care of your family. So, and then they gave me many advices how to do it, and I didn't catch many of them. But I understood one thing, that it is my responsibility now to take care of my family. And then they told me, don't cry, because if you cry, your mother will be sad. She's already sad about one incident. She had a loss, and then you cannot cry in front of her. So that was two things which I learned. So, okay, I did my best. I tried my best, so I didn't cry. So I acted so brave even when I was so scared, like that scared inside. And when I wanted to cry, maybe I took a long bath, because we stayed in a joint family, so I couldn't kind of get any other privacy inside my home. So I took a long bath and I cried in the bathrooms. So that was one thing which I did. So I don't know. It was too much for me at that time, and then over the time, I bottled up all emotions. So when I look back now, what happened to me? I never learned how to express my emotions, and I never had anybody to share. Like when I was afraid of something, or when I was abused, so I didn't have anybody to open up on all those occasions, and only aim was to study and then get a job. Yeah, of course I did that, and I achieved that over the years. But then even now, it has been 30 years since I lost my dad. But even now when I look back, like I can feel that anger inside me, which is coming up at times, saying that I lost my childhood. At the age of 8, I was asked to be a adult, look after a family, and then it was like losing all of my childhood. I never knew how to grow up, and I sometimes I envy my friends who has got that chance. So it was like that. Thank you for listening.
Ashla, every time you tell this story, which I force you to at times, this must still be hurting. And I'm sure everyone who is participating, like me, is grateful to you for this painful task. Thank you. Thank you for your sharing.
Okay, sir.
We are generally liberal with advice. We are not so good at listening. Ashla's eyes filled. Maybe there is a bit of healing every time you tell the story, Ashla. I'm not sure. I hope there is. Anyway, thank you once more. If I take away one lesson, that is exactly what Caregiver Saathi is doing. Get these stories out, get these messages out. One should listen. Everybody thinks they know everything and has inflicted an injury on Ashla. She was not allowed to grieve, and grieving is part of the healing that was denied to her. Uh, this is one important message that I take from your story, Ashla. Our generation did a harm to you, and the harm is now continuing by the next generation to the subsequent generation. We have to change that story with better advocacy. That is not to say that we should never engage children in caregiving. Ashla and everybody who is listening, I must also share this experience. In my early days in palliative care, Santosh was a small child. He must have been 4 or 5 with leukemia, to whom we all got very much attached. His father again had lost his job. The family was in dire situation. And the father and mother would bring Santosh. And on the second or third visit, I asked the man, "How about your other child?" He said, the boy, Santosh, has an elder sister, maybe roughly the age you were in at that time, Ashla. Uh, and I asked, because I knew that child is at risk. A sibling of a patient is at grievous risk of being neglected, feeling unloved, and developing huge emotional scars. Uh, I asked about the girl, and the man said, "Oh, that's another worry. She used to be very good in school, and she was such a nice kid, but in the midst of all these problems, she is also misbehaving. Her teacher is now complaining, and the other day she got into trouble because she stuck a sharp pencil into her another child's body and injured her, and there was such a fuss." Fairly typical. Because the man would listen, I sat down with him and told him what possibly was her side. All the attention is on Santosh, dad's mom's. Understandably, the child is sick. And the girl feels at that age, dad and mom don't love me anymore. And the feeling of being unloved, rejected, neglected is a terrible thing for a baby child to live with. And that's coming out as poor performance in schools, lack of attentiveness, and misbehavior. So we had a long chat, and the man and his wife. And I requested something. Today, when you get back, please give a hug to her. In the last few months, possibly you have only been scolding her for something or other. Give her a hug. Tell her that you love her. Do one more thing. They had not told her anything about what Santosh's illness was. Talk to her about the illness and ask for her help. Tell her, we have to look after your Santosh. He needs a lot of caregiving. Please help us when you can. And the man, 2 weeks later, said, now Santosh has 2 mothers. The sister is all over her. Just as it is wrong to inflict unreasonable responsibilities on children like Ashla, it is equally irresponsible to neglect children. If we make them feel an outsider, they must be brought back into the fold of the family. They must feel that they are loved, but also that they are able to contribute. That balance, I believe, is very important. Ready for another story? Maybe even more painful. Sangeeta, after many years, is a girl who is always on my mind, often with a lot of guilt. and a lot of pain. Sangeeta's mother was a single mother, manual laborer. They did not have a home on their own since her father deserted them. They lived in a small one-room hut in government property by the side of the road. They had no ration card, no existence, official existence. But living there and working manually, Sangeeta's mother put her through school, and finally she got into an engineering diploma course. At that time, unfortunately, the mother became ill. Somehow she survived, still continued to work when she can, and Sangeeta finished her engineering diploma course. And at that time, her mother became even more seriously ill. Her engineering diploma was just a piece of paper in the shelf. She could not go for work because that adolescent girl was a full-time caregiver. They had no income and they lived on what a cousin who is a manual laborer would who had his own family to look after. The handouts that he gave kept them from starving, but often they had to spend a lot of money on an auto rickshaw to take the mother to hospital and to buy all those often unnecessary medicines like multivitamin mineral preparations, etc., that we doctors are fond of prescribing. Her situation was so bad, we decided that we must help Sangeeta. Many things were done. We thought, one of the things that we in our naivety thought was to find a home, an elder care home, which would take them both. Sangeeta couldn't stay in that place alone, that wouldn't be safe, would take them in both, so that the mother would be looked after and Sangeeta could go to work. We were negotiating with so many people. In the meantime, we also talked to a rather famous television personality, Ashla Nosar Mala Parvati, and sought her help. And she talked about the girl and sought help. And then 2 days later, she rang up Sangeeta and said, Sangeeta, I have already got 18,000 rupees. Uh, Maybe by around next week, I'll drop in and bring the money I have. Sangeeta said, I'm not sure that my mother will wait till next week. Her condition is getting really bad. And Parvati said, I'll come tomorrow. The next morning, when Parvati went there, she found that instead of the usual deserted look, there were several people standing around the house. Parvati, in her agitation, wanted to open the door, and somebody said, don't open the door, wait for police. Parvati didn't care. She pushed open the door, found the woman lying dead on her bed, and found Sangeeta hanging from the roof. She had left a note to say, I have nothing more to live for. I am going. If you have got any money, give it to my cousin who has been feeding us. When Parvati told me that story, I asked her, my God, I can't imagine you pushing open that door and seeing that sight. It must have been such a shock. Parvati said something significant. No, not a shock. I felt a slap on my cheek. I felt as if Sangeeta was asking, where were you all these last 4 years? Friends, Sangeeta's slap is on the cheek of each one of us. An uncaring society who deserts a young girl and her mother like that, not offering support, not taking responsibility for the welfare of people around us. I still feel that slap every time I think of Sangeeta. And If you ask me why am I telling this story, such a sad story, not only to show what could have been done, I am glad that we could do something over the previous 3 years, 3 months after we found her. Even though that's such a tragic story, I believe those 3 months of some comfort to Sangeeta's mother mattered. Though Sangeeta committed suicide, I believe those 3 months of giving her some companionship, feeling that somebody cared for her, mattered. Of course, I do wish that we were more sensitive, we had listened more, built a close enough relationship to Sangeeta so that she would open to us. But what we did, I believe, still mattered. The trauma that we cause, or trauma that is caused by an adolescent being thrust into the role of a caregiver, I am sure can be huge. Smriti, are you with us yet?
I'm here.
Smriti, you went through this experience. Smriti Rana, by the way, is another colleague of mine, director of programs at Palim India. And Smriti had this experience of caregiving as an adolescent. Thank you, Smriti. I hurt Ashla by making her share. Maybe here is another hurt coming on. Please share your story with all of us for our benefit.
Okay. Thank you. And when you asked me to share initially, I was thinking how I can distill 2 very long years into 2 minutes. And that year was, those 2 years were a roller coaster. So my mother got diagnosed with cancer when I was 16 and a half years old. I had just finished high school, just starting college, and her sister, another Masi, she also got diagnosed that year. Another aunt who was their best friend, who was my godmother, she also got diagnosed that year. And it was strange that all of them got diagnosed in, say, Feb, June, and September, and the 3 of them died exactly 2 years to the day from when they were from when they were diagnosed. Anyway, for my mom, it was a big change for all of us because she was the outdoor person. My mother was a national level golf champion, so she loved the outdoors. She drove herself, all of that. And then to be plucked out of the Nilgiris, which is where we lived, to a city where she could be treated was very difficult. I had just started college in Delhi. But when I realized how sick she was, I dropped out of college without telling my parents or anybody. And I showed up at home one weekend, never to return to college, which didn't go down very well with my family. But I'm glad I spent that time with her. I can't quite describe what it feels like for a 16 and a half year old or 17-year-old to start having to bathe your mother. There were times when I had to help with like fecal impaction. I had to, like, there was nothing we could do about her pain. She had numerous surgeries, and every time she went in for surgery, we didn't know if she'd come out okay. What I remember from that time is everybody treating me like I was really stupid. And any question that I asked, I'm not talking about within my family, I'm talking about the healthcare system. My questions weren't important enough. Leave it to the adults to decide what's good for her. And a memory that actually causes me a lot of anger even today is when she was asked to undergo a very radical treatment. It was a nuclear medicine treatment. She was supposed to be in this room for radiation for it was a 4-hour, 5-hour procedure. And she was diabetic and they had overlooked it. And we were watching her through a glass window, and I knew something was wrong. I mean, she was the woman I knew better than anybody else in my life. She was my whole life. She was a single parent, so I was very close to her. And when I said something is wrong, nobody took me seriously. And then when they looked at it, they found that they had overlooked the fact that she was a severe diabetic and her sugar levels were all over the place and she was slipping into a coma. And then nobody would go into the room to switch off this machine. And I was so angry, but then my anger, I was treated like I was having a tantrum. But eventually they did go switch it off, and all kinds of complications followed. That was the day my mother stopped walking, because the entire intervention backfired so badly that it left her with tremendous nerve damage. And for someone who used to walk the entire golf course up and down the hills, to be bedridden was very difficult. And then yeah, so but she insisted on physiotherapy and stuff like that. I was of that time. So I can tell the story in two ways: either as a palliative care provider who knows what was missing at that time, or I can tell it as the child that I was. I will choose to tell it as the child that I was. Nobody wanted to talk about pain management. We didn't know that it was an option, and we were made to believe that the only thing we could do right was to make sure that she fought. And she didn't want to, but we forced her. I guilt tripped her a lot. I said, you have to live for me and all of that. Now, of course, if I look at it through the adult palliative care lens, I know what all the things that I did wrong. But I was also, as a teenager, getting into college, it disrupted my entire way of thinking. I was supposed to behave like an adult because by the time she died, I was 19. So I was expected to be an adult about it. But the illness happened at a time of I think my biggest transition, even from like childhood into adulthood. So it has forever shaped and changed the way I view things. But what I do remember are the acts of kindness that I experienced from random people in the healthcare system. And I remember them because they were so few. And I remember the few conversations where people sat me down and spoke to me like the adult they expected me to be. Those were also very few. Most of the time I was asked to just follow orders and instructions in dealing with the woman who was like the most important person in my life. So we didn't have a say. I didn't have a say. Yeah. So even when she died, yeah.
Now looking back, what did your experience do to you as a person?
I've learned, I think, firstly, to honor the feelings that young people have, no matter how young they are. And to remember that for the children, their loved one who is sick or dying is one of the most, if not the most important people in their lives. So the loss that they're feeling or they're facing, they may not have the words to articulate it, but they will find the words later. And it's up to us to ensure that the words they find later are not words of anger. I was angry for a very long time, Dr. Raj. And when I first found out about palliative care, which was literally 20 days after my mother died, I was livid.
Yet, Smriti, you, over the ashes of your life, which was destroyed in a way at that time, you built something beautiful. You built your life of compassion over that. Pranams to you. So proud to have you, Ashla, and both of you as my colleagues. Thank you. I'm sure everybody is very much touched by both stories. We heard the story of a child or two children, both the child that I mentioned and Ashla as a child, as caregivers, and the impact on the people. We heard Smriti's story as an adolescent and the impact on the person, positive and negative. Bhavana, I know I don't have a lot of time, so I will uh, skip something that I wanted to say in between to listen to this. We had a long car ride once together. I think I don't know where it was, maybe Mumbai,
Yes.
and that was such a privilege because during that car ride together, you told me the story of such events on generations in your family, for example. And thank you for agreeing to share that story with us. And the consequences of that irrational and insensitive behavior towards children as caregivers, what does it do over the long term? Please share that also, Bhavana.
So, ever since we had this conversation about talking about what I think of an impact of illness and caregivers over a long period of time, perhaps generations, I've been thinking, what is it that I would say about, my story? And let me just say this that somewhere along my journey to discover who I was, and this was well into my 30s, I chanced upon a program in which I had to, talk about. So, this was a program which was on discovering yourself, your leadership style, etc., through the archetypes of Mahabharata. And there was a discussion that was going on, and in that discussion that was going on, there were a large number of participants, and everybody said, I've heard stories of Ramayana and Mahabharat from my grandmother or my aunt, or my grandfather used to have these little gatherings and we would have these stories. And I thought to myself, well, I don't think I have heard stories of Ramayana or Mahabharata from my grandmother. And, I immediately had this feeling that, oh, but, so I, I, I didn't hear that from her. So what did I hear? I actually heard more about the partition of India from my grandmother, who we grew up with. And she was not much of a storyteller. So she wasn't this conventional person who, would say, okay, come on, children, I will tell you a story. But whatever our interactions that I remember of her, they were more about stories around partition, the family that we had left behind, the family that we belonged to, and so on and so forth. And so I decided to figure this out, that who is it that I am and what are my roots. And to cut a long story short, because obviously going back generations means, there are many stories and there are many, many things. Uh, the one that struck me was the fact that my great grandfather was a doctor in Lahore, and he was around 40 and a very committed doctor who was once called upon to by a patient, and he was himself suffering from typhoid, and it was advised that he not go because there wasn't cure, and that it could potentially be fatal. However, legend goes, and that's how stories are, right, in the family, that he decided to not listen to this advice, but actually go because it was the call of his duty. And he went. He was all of 40 or 41 with very small children, the youngest about 6 months. And it was fatal. And, he had just been elected the mayor of Lahore, and uh, he was no longer around with a very large family. And soon after, so there was definitely an impact of the head of the family gone, and the fact that there was a large family. And very soon there was partition of India, and our family that was based in Lahore had to relocate to Delhi. For many years, I had seen my grandfather as this person who was this quiet person who did not have a typical dominating presence in our family. Grandfathers, patriarchs, you know how our society and family is. My vision of my grandfather is that of a frail person, did not necessarily push his way through. Many years later, I realized that he was perhaps the product of a lot of what he took on to look after his family as a young 17, 18-year-old, and just took care of the family through many things that happened in our family. Not just the loss of his father, not just having to bring up a large family, not just the loss of his young child. You know, he was a man who faced a lot of trauma. I believe, this is my fantasy perhaps, but I believe that it definitely made him the person that he was. And in him being the person that he was, it impacted the kind of family unit that was created between my grandparents. And that uh, created a certain quality of a setup, which impacted perhaps my father and my aunt. And they grew up in that family and with those kind of values and perhaps a certain attitude towards expression of love, expression of what is okay and what is not okay, whether or not to express too much joy because it may not last. Um, I definitely believe that I am a product of all these things that happened over the generations. And it is believed that if we do not do the work to recognize the steady feet and the tall shoulders that we stand on, and we do not heal the pain that flows down generations, we will pass it on to the next. So we do not recognize sometimes that our grandparents and parents may have, uh, you know, had certain circumstances, but they define not just them, but the kind of people that we become. So I find ways to recognize and to find, acknowledge, and honor their struggles, honor them for what they have given me despite their struggles, so that not only can I heal the pain that I may have inherited, but also the pain that just runs in my family.
Bhavana, thank you. Building from the stories that Ashla and Smriti gave, what you have brought out so clearly is the long-term impact. It is not just one person suffering. It is something that gets passed on. There could be positive effects out of it from remarkable people like you three, but very often it may not be so. The calamities, relationship issues, the frustration, the anger, etc., are often disastrous. Thank you. I will quickly also talk about something that we can do about it. Because what's the point in mourning about issues? Uh, in our country, healthcare is run by doctors and nurses. Okay, there are social workers here. There are a few psychologists. Maybe, I don't know how many, maybe about 10 for the whole country. Not a common thing to be seen. But they are all considered optional extras. And how can that system take care of issues like this? Um, Bhavana, Nabia, and others, let me share the screen and show a few slides. I started with this painful story of this child. What could we have done when this happened? We had to change the story. This was unacceptable. What was being done was unacceptable. And Smriti's story. So adolescents were already struggling with the conflict between childhood and adolescence. And you all know this. Those who have gone through this know. Those who have adolescent children know it much better. That this 15-year-old whom you have always hugged like this, you go and hug her or him once and they draw back. I'm not a child kind of look. And then you stop hugging because you don't want to hurt her. And then 3 days later, they complain, Mom, you don't love me anymore. This conflict is not easy to live with. And then added to this conflict, all of a sudden being forced into adulthood and to live forever with physical, social, and emotional scars. This happens in the context of a social transformation. Bhavana, I realize that I have far exceeded time. I'll be brief.
No, that, not at all. It's fine.
So over 2 generations, particularly last 1 generation, joint families are disappearing, and the nuclear families are becoming more microscopic, especially when men migrate to find jobs elsewhere. Simultaneously, something else that happened was all the small hospitals, village clinics, you know the kind of thing, a small clinic run by a doctor nurse couple, something run by a religious mission, etc. They are folding up. They cannot withstand the corporate invasion of the corporate hospitals, and bigger hospitals getting bigger and bigger, smaller hospitals are getting destroyed, and this tiny family, whether they are poor or rich, it is the same thing. If they are rich, they can drive to this place. That's only different. And in there, they are all strangers. All of a sudden, a frightening system takes over. They have no control over it. This is a reality. Health system moving away from people, and families becoming smaller. And the answer that we have found in Kerala is to build what is called the meso element of the social capital. If we define social capital, can be defined in many ways. If we define it as the positive product of human interaction, you can also say that it is a product of positive human interaction, because there can be a negative one also. That is what we are trying to build in Kerala. This experiment over the last 27 years has been quite successful, as Zhou has from Philippines has personally seen in Calicut. Let me expand that middle panel to show what that means. You see, Smriti, you see Srikutan and Rahul there. These kids ordinarily get out of their home only to go to hospitals or to schools. No other outings. The rest of the world is not for them. And our volunteers from the community gave them an evening by the seaside. It took 150 students to bring 1 or 2 of them from the village, to pick them up, bring them in an ambulance vehicle to bring this place. But these people had something that the evening by the seaside you may take so philosophically and casually. For them, it was possibly the first time in their lives, that treat. And is that important? Is that important? What is health? It was important. That child got pain relief, lived pain-free, and died in 3 months. That was not enough. Our volunteer and a social worker together pestered the man's previous employee, and totally because they are being a nuisance, he gave him his job back. Was it the job of the healthcare system? The man got his job back. The woman had to be shown to a psychiatrist. A volunteer took her with her and waited in the consultation room and got the woman seen in a psychiatrist, and she responded to treatment. And it is one of the most heartening feelings that the child did not have to be a mother anymore and got her childhood back. All these stories are not negative, but to make this happen, we needed the community. The community and professionals got together to provide what is true healthcare, because health, by official definition of WHO, is not only absence of disease or infirmity, but physical, social, and mental well-being. And if we pretend to be healthcare professionals or healthcare providers, this has to be achieved. For that children like Ashla someday and Smriti someday and that tiny kid and her sister, and for Sangeeta, this is our duty. It is not an optional extra. For this family, the story was changed. But this is a change that we can bring to many, many, many stories. If, especially we professionals, act as facilitators to get the community together. If I have one message from today, that's about the suffering of children and adolescents as caregivers. But even more important message, let the community come together. Today, healthcare is a mockery of healthcare because we either cure diseases or worsen the suffering. We can cause that transformation and make healthcare what it should be. Thank you very much.
I'm just going to allow for there's so many comments in the chat box. We have a very large group of people that have come in. Quite possible it's your celebrity status, Dr. Raj. But I do think that none of them have been disappointed because they seem very moved by the fact that it is an unusual and a difficult topic, and moreover it was addressed in such a beautiful way, because I am trying to mute. Okay, so we know this, that storytelling or telling our stories can be healing. There are times when we tell our stories, and we have said it so many times, it can also be a little bit like, oh my God, I've said this so many times, and what else is there to say? But I suppose, at least for me, every time I tell the story, there's something that shifts. I see something that I haven't seen up until now. And sharing our stories is powerful. Um, I would like to bring up a couple of questions, Dr. Raj, that have been in the chat box. Is that okay? So there is a
Yes,
question.
please.
Yes, so there is a question about we need more compassion in our society and neighbors. How can we make our neighbors and societies more compassionate?
There is compassion in the society. Whether it is Mumbai or Kerala, whether it's Iceland or New Zealand, there cannot be any part of the world where a few compassionate people are there. And there are a lot of people looking for meaning in their lives. But they are strangers to healthcare. And we, healthcare professionals, have to be ready to welcome them. Hemal asked this question: how? We need a facilitator. The compassionate people do not get together spontaneously. We need to welcome them. And Not all that difficult. When COVID-19 came, most of our volunteers could not come anymore. We just gave a press release. We need people, we need people between 20 to 40 with automobiles ready to go and supply medicines. We need lab techs and nurses ready to go and collect blood samples or do things like that. And in 2 days, we had about 90 volunteers. We could not make use of all of them. They are there. We have to decide what they can do, give them a task, and then value their services. We have to train them. They are strangers. They can do potential harm. Give them training. And when they achieve something, make sure that they are paid well in terms of satisfaction and being valued. They don't take money, but they need to feel good that I have contributed.
I totally agree. And I was wondering, it would be very nice to hear Smriti or Ashla as well talk about what their take on this question is. Smriti,
I'll let Ashla go first. I need a few minutes to compose myself, I think.
are you okay?
I'm fine. Well, that's a lie. It's not. I was just saying that my it's 20 years since my mom died, but just recalling these details um, was not easy. So that just goes to show how important it is to be mindful of how we deal with young people, I think. So yeah, but this is
Okay.
very therapeutic for me. Thank you. It is
Yeah, no,
healing.
please take your time. Sorry to have.
No, not at all. Not at all. Ashla.
Yes, Ashla.
I also agree with Dr. Raj. Like we do have people with compassion, and but something which we did here in Palim, India, or in Kerala was like to engage students who are going to college. So they also find that okay, they can do something more than merely studying their subjects and writing exams and passing out of college. So they also find that those communities are, they take it as their responsibility when we are there to guide them or to sensitize them about the needs of the society. So there are people, but they don't come out easily or they don't know where to go and how to help. So as long as we are there to facilitate that kind of a connection, I think we'll be able to get more people to help us. We'll find that the society is still having compassionate people around us.
Bhavna, yeah, I found my train of thought. And I think what would be great, uh, if I can just take a minute to explain a story why I'm saying this, is to cultivate this sense in children themselves. Because when we were running the children's program in Trivandrum, we had initiated a toy donation drive. And my brother's children, who by I think every parameter can be considered privileged children, living in a healthy household, healthy parents, very well loved by all their relatives, in a good school in a first world country. And they asked me, Bua, what is this toy donation drive? And explained to them that there are these children who are not well, they're about your age, and they have no toys. So can you send some of the toys that you don't play with anymore? And I have a video which at some point I will share with you. These two lovely children sat down and made a video for the kids who they didn't know. And they pulled out their favorite toys, not discarded toys, favorite toys, and made a video of how the toys are to be used. You can change this one's hair, you can change the battery here, and these are our favorite toys and we want you to have them. That's all it took. And I think we need to normalize this for children who are healthy, that there are children who are probably less privileged, not just in terms of sickness, but children are far easier they absorb this faster than adults. So I would really say that normalize these conversations around children. They're going to grow up to be the change makers.
Yes.
Thank you, Smriti.
Very powerful. So, going to the questions, what I realized I was technically an adult when I lost my dad. So, I realized how I didn't talk about that part of my story. I spoke about the inheritance. So I was technically 26, but I do think that a part of me was a child, right? I was my father's daughter. So, and it was to that earlier point hard to grieve because there were so many other things to be done. And it is unfortunate that we don't have the space or the normalizing of grieving that can take many, many years to sometimes ease and go. So there is a question about how can you counsel children who are experiencing trauma or are going through tough caregiving. Dr. Raj?
Oh, there are so many people here who can answer that much better than me, but I am here in this chair today. How can you counsel children? What was the rest of it, Bhavana?
So, how can you counsel children who might be in caregiving responsibilities or are experiencing the trauma of caregiving?
Most importantly, by listening to them.
Mm.
There is no other secret there. And that is precisely what we are not capable of. We are so busy telling people things, telling children things. Oh, after all, he's only a child. Give a lecture. Ashla, you must uh, be the man of the house now. You have to look after your mother. 80-year-old child. Smriti, stop asking questions. Do as we tell you. Are you the doctor or am I the doctor? We need to open our ears and listen. And that is so enriching. Elizabeth Kubler-Ross talks about this child she found sitting by the side of the road alone, and the child was looking so grave that she went and sat beside her. She didn't say a thing, not one word. She said she sat there for 7 minutes, and the child then said, I am thinking of running away.
Mm.
And Elizabeth Kubler-Ross said, oh, that's a big decision. And the child opened the shirt and showed his chest where an electric iron had been placed by his dad and burned him. I'm sorry, but that is a horrendous story. But the lesson that Elizabeth Kubler-Ross gave is one of silence, being willing to listen to the stories, and they will tell you what they feel inside. In fact, to get the stories out from children is 100 times easier than getting them from adults. They are more open, they are more innocent, and they will tell you, if only you sit down and shut up.
Mm. Indeed, indeed. There's one thing that's my question. So this is not in the chat box, but it's something that I have been wanting to ask and maybe in this forum, which is, there is this one thing that's often thrown around that, children are resilient or children will adjust. It just, I don't know, there's something that just moves me in a very difficult kind of a way. So, what is this thing about children are resilient and they will adjust, and or that they need to be protected and kept away from information? So, how do you bridge that gap? What are your thoughts on that?
Children have their own resilience, and they respond so warmly when you offer them anything that is real. Unfortunately, we all love children. We are cruel to them.
Yes.
We don't try to understand them. And okay, somebody has done something cruel to the child. You will see the child playing after half an hour. That doesn't mean that he is not hurt, that there is no wound. The mother dies, and the child, after half an hour, goes out and plays with other children. But the games may have changed. What she plays would have changed. But that's the way children are. And if we only recognize that children are human beings, that's not easy. We consider things to be loved. If we take them for human beings at any age, when they are able to speak, either with their eyes or face or with their voice, listen to them and they tell you stories. And then respond with compassion and your ears. And that is the answer. And they will lead you, they will teach you what you have to do.
Smriti?
Yeah, I just wanted to comment on that. Yes, children are resilient, but that doesn't, it's not an excuse for us to shirk our responsibility towards them. Because to say a child is resilient, he'll figure his way out or whatever. If that were the case, we wouldn't be a world full of wounded adults today.
Correct.
And but that's where we are, right? I think the balance is that understand that a child is hurting. The resilience still needs nurturing.
Yes.
There's resilience that can result in something good and powerful blooming, and there's resilience that can turn into something completely destructive. And so, yes, very importantly, I think we as adults are afraid of children at some level. We're afraid to have conversations with them. We are afraid to meet them where they are. We seem to forget that we were children sometime back, and we say, and very often saying that they don't understand is just our way of not going there because we're too scared to go there. So it really, the responsibility is on us to learn the skills and the language. And sometimes children talk through play very often. So we have to learn, we have to relearn the language of play as well. That would do us good as well, I think.
Certainly. I think very well put. I think the whole point of figuring out what is being said without being really said is something that we can all learn. Ashla, would you have something to add to that?
I'm sorry, I was distracted for a moment.
We were talking about, this notion that children are considered either resilient
Okay.
or
I thought you asked another question, sorry.
or they're overprotected, right? I think we swing to the either extreme. And
Yes.
so, any thoughts that you might have about that?
Even I also accept with Smriti that if children were that resilient, we wouldn't have ended up with more wounded adults like me. If I could, I'm sure that when I was told that I have to grow up, I tried my best, but then still I couldn't do as best as it was possible. So at least if only I had somebody to hug me or somebody to trust so that I can open up. So we need to be there, and we don't know what they need, but then we need to be there listening to them, and then they will show us the way. That's what even I felt with children. We cannot we assume, and then that comes out as a very wrong answers always. We just ask them, okay, what is it, and they tell you what it is.
Yeah.
So that would be so different than what we thought it was. So I think it is so important for us to be there, available for them to share whatever they are going through.
I think so. And I do think that it is a part of our endeavor in these conversations. And thank you for, raising the the awareness, the sensitivity. Dr. Raj, you in that conversation almost a couple of years ago, it was brought up, and it is something that I wanted to also definitely bring about in caregivers, because very often, first of all, caregivers are seen as the attendants and the nurses and the people who provide care. And if at all you do move to family caregivers, it is really the woman of the house. And then, very, very rarely do we see the whole unit. And very, very rarely do we see children as, caregivers of a certain kind in a family that might be grappling with illness or early death or anything that is off normal or of a difficulty. And it is important to raise the awareness. It is important to have these conversations. And I'm so grateful that not just in one on one conversations, but in this forum, you helped us see child in such beautiful ways, painful stories, but still. Would you like to make any closing remarks?
The first step is to recognize that children are human beings and they have emotions. They may not show it. They will be good at following advice. They take us seriously. They take seriously when you say that your mother is in heaven. They take it seriously that, as Ashla should, you should not cry. And certainly we need to understand children. We also need to help the community understand about grief and understand about children. We need to, everybody says, don't cry, don't cry. What are you really saying? When you cry, I feel upset. Don't upset me. Just contain your grief. Let you explode later when you are alone. And maybe, Bhavana, your strength is in advocacy. Maybe everybody here needs to be an advocate. Advocacy is the key. As Madhi said, such a lot of burden in the community could be relieved only if compassionate people knew a little more. It's not enough to be compassionate, it's not enough to be palliative care people or psychologists or social workers. It's important to be advocates also.
Yes.
Thank you.
Thank you so much. Thank you very much, Dr. Raj. Thank you so much, Smriti and Ashla. And I must also thank myself, because even I was partly a speaker.
Thank you, Bhavana. Smriti and Ashla.
And sharing our stories or perspectives. I'm very glad that we had this conversation today. I'm going to request Nabia to just launch the poll for your feedback on the webinar. And those of you who may like to leave comments or feedback or ideas about what should we cover in our subsequent webinars, please do so. Thank you so much, Dr. Raj. Really appreciate this. Thank you, Smriti.
Thank you, everybody. Thank you, Bhavana, Nabia,
and
everybody.
Thank you, sir. Thank you very much.
Thank you.
As always, Ashla, you're a rock star.
Thank you. Thank you so much. Just nice meeting you all. Thank you. Leaving.
Thank you, Bhavna. Thank you, Nabia. Take care.
Thank you.
Good to see you, Aditi.
Same here, Bhavna. Hope to come there soon and meet you all.
Yes. Up until then, your videos are welcome.
Yeah, sure.
And of course, if you have some time, we have some work.
Yes,
Oh, hi, Anish.
we are waiting for certain boomerang interns.
Yeah, I was just waiting for such comment from Anish. I was like, I thought Anish is not here.
No, I see everything. I saw Anjali was also here.
Yes, she was.
The two of
I
you
hope
can't
you're doing
escape.
good.
I don't know about that.
Okay.
We can do better.
Yeah.
Yeah.
We were
Okay, take
All right.
care,
See you guys.
everyone.
Bye.
So officially this session is closed. Those of you who are here, we may request you to leave. The Caregiver Saathi team can hang on, please. Thank you very much. Nabia, you are logged in from two entities.